Source Pro in Conversation is brought to you in association with Leapin, Australia's leading plan manager and two-time winner of the Most Outstanding Plan Management Award. Visit leapin.com.au to learn more.
Hello everyone, I am so excited to be here. I'm Caleb Brixton and I'm thrilled to be hosting this segment where we're going to be zooming out of the therapy room and looking at how we work with families, teams and communities to drive real lasting change. Now please join me in welcoming Melissa Locke, a globally respected paediatric physiotherapist and a leader who has spent decades shaping both clinical practice and the future of the allied health profession, the workspace, and also Clare MacFarlane, the founder of Pitter Patter Physio, and a practice that is built from the ground up on truly collaborative, family-centered care. Together, they're going to be unpacking what collaboration really looks like, from mindset shifts to practical strategies, and how we as professionals can rethink our roles to better partner with families and fellow practitioners. Please welcome Melissa and Clare. How are you both today?
Good.
Looking great. Fantastic.
Thank you.
Loving the curly hair and the glasses. I thought, let's team with a theme,
Yeah.
All right. Yeah, so straight into it. I want to find out a little bit. Melissa, you have had such a remarkable career. It's incredible across both global leadership and hands-on pediatric therapy. So what does truly collaborative work, what does that mean to you? Truly collaborative care, and why does it matter more than ever, right now?
Yeah, great question. And you said it in the introduction, Caleb. It's first and foremost family focused. So there's the true collaboration with the family. What are their goals? What are they able to do collectively as a family for their child without forgetting their other children? So I think that's the first bit. Right. Making sure that we consider the whole family unit in the care of the person who's got needs. Mm-hmm. Then, look, allied health, we are great collaborators. It's in our DNA. Yeah. So I think I'll take
it. And the name, allied.
Yeah, exactly. So let's just take that as a given. Yeah. But then I think it is about other systems and other environments. So definitely the need as a community or a private practitioner to communicate with the hospital team, to communicate with the education team, to establish what your goal is in that really big group who are looking after this child, because parents can get confused. And also I think truly collaborative care is to acknowledge that there are health issues there as well as disability, right, and which one needs to have priority at different times and which focus needs to have priority at different times. Is it speech because you've acquired walking? Yep. Is it education because you've started school? Yep. So that's what I would call collaboration across the spaces and across including the family.
Yeah. That real true sort of continuum of care in a way.
Across the lifespan.
Yeah, across the lifespan.
The environment.
I love that. So Clare, speaking of working across, you've worked across clinic, home and community settings. What are some of the biggest lessons that you've learned about working alongside, not just sort of with, families?
Yes, very similar to what Melissa's just talked about, including everyone's goals and really understanding what means achieving for them. So I'm great at doing the therapy, the hands-on equipment, the on-the-ground type stuff, but parents are the experts of the child. What else is it that they want to be brought in on? What else is the kid working towards? So when you sit alongside the parent, they're the expert of the child, I'm the expert of the therapy, and we go together and go, okay, where are we headed? What are we doing with this kid? What can we achieve together? So that's great in the home setting. You can see what have they got, what's their setup, what do they need, what can they achieve in their home environment. When you go into the community setting, whether it's at school or a playground or other friends' places, you can also look at that similar kind of setup. What are we working towards? How are we going to do this together? How is the teacher going to help? The therapist going to help? The speechy, the OT, the family, the equipment, like what can we do all together? And then obviously in the private practice setting, we kind of really hone in on that physicality of what we need to work towards for all of that. So I feel like sitting and listening to the family and really understanding what it is that they are hoping to achieve with their child, working alongside the child as well, and what are they interested in, what do they want. Sometimes parents are like, I really want them to walk, and the kid's like, you know what, I'm so not interested in that. I can get around.
Care.
I'm not here for that. I want to just cruise around with my friends. I'm happy to bum shuffle around. I'm happy to crawl.
Yeah, cool.
So it's really kind of having that the understanding of both of them, not me going, well, you know what, you should be walking because that's what your parents want to do and that's what you need for the school. It's kind of paring it back a bit and going, okay, well, maybe you're not ready for it now. How else can we encourage you to do something like that? So it's kind of not just being, hard and fast, this is what it is and it must be this. What can we do together? Because the child's going to resist you if you're trying to,
And it's that advocate role, isn't it? Like you often have to be the go-between for the family, the parents, and the child, and
big
not
time.
and acknowledge the grief, the absolute grief, and the absolute deep kernel of privacy that grief is needed for that grief sometimes. So being really respectful of not overstepping that mark because we have such a strong relationship with families.
That's beautiful, that way of sort of like the deep kernel conduit really between those things. This session, this is all about going beyond the therapy session itself, and it's really, for myself as someone with a lived experience of working with physios, I started out after I had my stroke I wasn't able to move, but then eventually I was able to utilize a wheelchair and then a walking stick and all of that sort of stuff, and now I'm I don't use any supports. Physio plays a huge role in that. And it can be I think the perception of physio can be quite fixed and I think you probably felt this, it's quite there's so much in physio, right? But going beyond the therapy session, I love hearing that you're as professionals, as it's in the name, Source Pro, but as pros of physio looking beyond, how do you what do you see as the most powerful shifts that therapists can make so that it's not just looking at sort of the session that we're doing, but the week ahead for the family? Melissa?
You have to be a warrior. So you have to change the systems again, I think I would say. So you, as physiotherapists or occupational therapists, speech pathologists, you get involved on boards, on committees, writing those letters to make places accessible. You do the extra mile because you've got the expertise. So I think that's a really important thing. You can't, and it's hard. You get caught in the whole treatment and problem-solving component of it. For me, that's been my passion. I've gone that next level to be past president of the APA or vice president of World Physio. None of that, I didn't go looking for that. That just kind of happened. So I think that you've really, advocate, see what other areas are doing. For me, see what the United Nations does, see what World Health is doing, see if you can bring that back to make places more accessible so families can participate. I think the other thing is educating for me, and it resonates with a story that many years ago one of my mums said. We had a hippo camp, you know, and we had Lily was going out camping with a family, and they were in a creek, and a very well-meaning other camper came up and said, "It is so lovely that you've got your child out here." And the mother said, "What do you mean? She's my child. She's part of our family." So I think we have a role to educate the public as well, who haven't got a lived experience of disability, what inclusion means. And that's, I think, then how you get it out of the treatment room.
Yeah, I love that. You've sort of described before that therapists need to rethink this role, right? And not just as the provider, but as a true collaborator. What does that mind shift actually look like in everyday practice?
So here's an example for us. You know, I've been in private practice for 34 years.
Bring it on.
I went to the wedding of 2 of my patients last year.
Oh, beautiful.
That, you know, who I started seeing when they were 2 and 4. It's, for me, we've had to shift our practice from being a paediatric practice to being a children's teens practice, children's teens and adults, children, teens and adults of all abilities, caring for the parents who have injuries associated with looking after their children. One of the big shifts we've done, we would have about 90 children every week of an afternoon, Monday to Friday and Saturday morning, who come into our all abilities gym in preparation for them to be able to, so we start in a one-on-one, they might need one-on-one allied health assistance. So the use of AHAs for me has been really big. It's been one of the ways you can pivot with the funding challenges that we're all experiencing. So they're under supervision, there's always a physio there, but these amazing young men and women who are of an age that they can really relate to the kids. I'm getting a bit, you know, I can still relate to the kids, I think.
Please.
But, you know, I am looking older.
Yeah, sure.
And so there is a grandma or an aunt, I like to think, effect. But they have this fun, they learn to bring their own water bottle, bring their own towel, wipe down their mat, connect with people, get used to it so that they can then go out into the community gym or boxing or soccer or whatever. And that's how practice has changed, I think, for us. We're doing much more group-based, but with a biopsychosocial effect.
That is beautiful. Oh, biopsychosocial. I'm going to use that. Thank you very much, Melissa. No, it's so lovely to hear that approach, again, is so rooted in not the clinical. I mean, it's founded in clinical, but it's a social lens. And I think that's a really important part of like the social fabric of, I mean, our human experience, right? That is the thing that connects us, and seeing things as a social experience, not just a clinical one.
And school holiday programs. We've just finished our bike riding program in the local park. 4 of the 6 got off their trainer wheels and got going. They're there with their families, they're there with the community going, what are you doing here? What is that modified bike? What is this all about? So taking it out into the community, which Claire does so well.
Beautiful. And I guess, Claire, your clinic has literally gone from a back room to a multi-space with hydrotherapy. I never got to do hydro, which I'm a bit devastated about. But anyway, open floor areas and something I'm very passionate about, an espresso bar. Well done, well done. Pitter patter, pitter patter. What does this tell us about designing therapy environments that also care for families and foster real engagement, not just caffeinated engagement, but real engagement?
I guess that's kind of like, it goes a little bit to your previous point that you guys spoke about. And for me, and a little bit further on, it's about that connection. Yeah. And I feel like these parents are coming to us with their child and they're like, I don't know what to do. They're not lifting their head, they're not crawling, they're not moving. I need you to help. And I've got goosebumps. So they're putting their whole trust of their child's development in your hands, in our hands. And And for them to trust us, we've got to have a connection with them. And, you know, part of our values is outstanding, welcoming and limitless. So part of the space I wanted to, and it's OWL, which spells owl, so there is a connection.
Well done, well done. Hoot, hoot. Yep.
So, you know, for to be able to create a space that families from all walks of life can walk in and feel like, okay, I'm safe, I'm welcomed, I can make a connection with people, we can create that trust. My child is going to feel that same level of connection. So obviously we know that if the child likes you, they're going to hang out, and they're going to want to do the things, they're going to want to play with you a little bit more, and you know, you create that relationship. So you know, we were in the back room of a house, and that was very obviously quite homely. And now having a space where we've got the open plan in some sections, which means that, you know, we've got people coming in and getting coffee that are off the street, and they can see, what are you guys doing? This is what we do, educating people. So really opening up in a different way. We've got siblings of kids that are coming in and playing with other clients because they're of a similar age. So we're really working on inclusion. My kids come in and will help some of the other therapists with some of the clients because they have that little friendship, and they've been there for so long, and these clients have been there for so long, so they have that. And then my children go out into the world and they see someone else who's not talking or walking, and they're like, it's okay, I know how to play with these guys.
How can I help you?
What can we do? How can they be included in my group and my play? So
that's it. True inclusion.
It's true inclusion, and I just want everyone to feel like a big hug, you know? Like I want the parents to come in and feel safe. I want the kids to come in and feel safe. I want everyone to feel as though they can be who they truly are. And then with that, we uplift them and be like, you know what? I know that someone said that you may only be able to be in a wheelchair, but let's see what we can do. Like, let's put you in the hydro pool, let's put you in the cage, let's do CME, let's try some other things, and let's see what we can achieve together. And they're like, yes, I trust you, and we know each other, and we've got that relationship, and they're more likely to try new things or work a bit harder or be able to bring that home, that stuff you're teaching them, take it home and be like, yes, let's do this. So,
one of the other things we've done, we employ many of our patients, and nearly most of our physios, most of our admin staff, my son, work at the practice who have a lived experience of disability. And for me, one of our staff on the front desk is neurodivergent, and families come in and say, that gives us such confidence and hope that our child will get a job.
yes.
And I think
similar. We've got similar. One of my clients' mothers works with us on our administrative team, and my other chaos coordinator, that's what we call them, because they organise us. His sister has a disability, so he has that lived experience as a sibling. So for him to be able to connect with the kids and support us in our therapy and whatnot, and obviously booking and phones, and he understands the stress of parents.
Absolutely.
You have a parent who's freaking out about something, which is so understandable. He has this calm, you know what, I understand. So having that connection from lived experiences as well as a space for that. And obviously coffee. Because everyone needs it.
Thank
and
God.
we've had families who've like had a chat because they both stood there and Will Lewis has made them a coffee, and they're like, oh, my child. And then they've made play dates outside of the clinic. Amazing.
Absolutely.
I'm
You really
a
don't.
big fan of that.
I think one of those things that what you're both sort of describing in that environment, in particular your environment that you've set up, is it really shows someone like there's just incidental stuff that you wouldn't know. It's just positioning it there to truly let living expertise be the expertise that is guiding the way. And I think I think it's seen as a real brave leap, and it is in a lot of ways, particularly when it's a business, but it's something that's so necessary and it's so bold to do. And I really commend you for like doing that and continuing to push that forward, because, you know, we've got to, we sort of, there's a whole lot of talk in the space, but to really walk the talk is the next thing. So I think it's a really important thing that you're doing that, and really valuable. Melissa, you have, Melissa, I now like to get very serious, and I'd like you to mentor me through something I'm joking, but you have actually mentored many therapists from all around the world. What is one piece of advice that you always come back to when you're helping them to rethink their impact?
There's a few.
Yeah.
First thing I always say to them is the Hippocratic Oath.
Yeah.
So do no harm.
Oh, that's nice.
Do no harm in your language,
Yep.
in your advice, in your manner. Then, of course, and I say to them really quickly, do good. Well, all right, so that's the first bit. And that's the bit that everyone forgets about the Hippocratic Oath, that you've got to do good, because what's the point?
Yeah.
My other thing is, I alluded to it before, whilst you have wonderful relationships with families, you need to be really careful at times where that boundary is, because sometimes you've got to make the tough call or the tough conversation. Never for 1 minute think you know what's going on when the family go home and close that door and are there together.
Yeah.
Never assume how they're coping. You know, ask the questions when it's appropriate to ask the questions.
Yeah.
The other thing is, and I don't want to sound like someone who says you can't tell someone about what it's like to have a baby until you've had a baby, which you often hear. But you do need street cred.
Yeah.
You've
got to have those runs on the board.
You've got to have those runs on the board. You've got to have empathy. You've got to have those experiences to have that empathy that family needs. And sometimes that's sympathy. If it's your journey.
If that's right.
If it's been your journey. But also, and I guess for me, the other thing I say to them, do not stop learning. And there is no ceiling on outcomes for children or anyone. You achieve a goal that the family wants and the child wants, and then you go, okay, what's the next one? Don't just sit on your laurels. Don't just do the same treatment. Don't rest.
Yeah.
Or you may as well go and be a florist or an interior designer, do something else you like, because that's not what paediatric physio is and disability physio is.
You never know everything.
You never know it.
As soon as you know more, you realise you don't.
Yeah, that is so true, right? The more you know, the realise you're like, I don't actually know much at all.
Yeah.
You're a lifelong, and you go, I think back to 31 years ago, I was just, I was faking it till I make it on that one.
And I feel like a lot of people coming out go, oh yeah, I've done the degree, I know what I'm doing, I'm going to go straight into this area. And you're like, well, okay, well, you've done a 2-week placement in paediatrics. You might have had I don't know, a day, a week.
Yeah.
Guys, absolutely, we're here to help, support you, but just know there's a lot to learn, and it is constant learning. And I think it's also looking outside of what is in the textbooks and what's fed down, like looking in other countries and other research, and we don't have all the answers. There's a lot of stuff out there across the whole world that is stuff that we don't get taught, we don't get exposed to.
And we are a small country, and Brisbane is a small town. And so, and we are look, absolutely it's right to be conservative and for evidence-based treatment, but there is an art as well. And there is research and outcomes that are being done in other places that because of need. A great example for me is I've spent a lot of time with some sub-Saharan physios, sub-Saharan Africa. They do the orthopaedic surgery on the child with the club foot in the field because there isn't an orthopaedic surgeon to do it. So they do the percutaneous tenotomy, then they cast them, because that's what it is. Let's also see what our scope, I think there's the next challenge for us, or for the health system and the disability system, the funding systems. Let us work to our scope. But don't expect the new grad physio or OT or speechy can work to the scope of someone with 15 years experience, such as Claire, or 15.
I love that. Let us work to our scope, do no harm, do good, do good. Speaking of doing good, there's a growing call for interprofessional care, but it's not always easy in busy or siloed systems. So just quickly, what are some strategies, Melissa, I'm going to start with you, that you've used to build stronger working relationships around disciplines?
Yeah, I guess the one that comes straight to mind is I do a lot of work with OT, speechies, physios who aren't paediatric physios remotely. So they're there seeing the patient in Bowen, in their home. They don't have all the expertise of what the latest chairs are maybe, or what the new ideas are on intervention, or the new sort of shoes that might help instead of AFOs, which they're going to outgrow. So for me, that's true interprofessional collaboration. I love it. That's my bit. After this, I'm heading out to the Big Red Bash, but on my way, I'm stopping at a whole lot of physio practices and medical practices, and to go, here I am, hi again, how can I help?
Great, and you've got the glasses to match.
Oh yeah, a Big Red Bash, and there'll be you can't take a bottle, so there might be a cask of the Big Red.
A cask. I love we've escalated to a cask. I love that.
Yeah.
What about for you?
Similarly, I work with a few clinics doing some mentoring with them. We share a lot of clients, and I find that's quite nice collaborative too, because they might come to me for intensive or weekly and then go elsewhere for similar type of stuff.
Because it's closer to them or whatever. Yeah, exactly.
And they do weekly stuff there, and they come to me, whatever it might be. And I find that's been beautiful because I learn from them with some of the questions they ask. I'm like, oh, that's a great question. I've never actually come across that. I'm going to look it up. Or, obviously I'm helping them out, which is in turn helping the client, which obviously is what we want to do. But also, working, we've got a podiatrist that works with us on a Thursday, and it's been amazing to have, my PhD is in lower limb orthoses in children with cerebral palsy. So him and I get to geek out about feet and footwear and orthoses and what can we do and how, and we've got a real similar... It's so much fun. And we just get to, like look at it from a different perspective, and I can be like, hey, can you come and have a look at this foot? This is what I'm thinking, but I'd love your expertise. And so we really get to collaborate with our clients. But then again, if it's someone who's a shared client or someone who comes to us for different therapy, they then go on and they've got education, and then he goes and helps them in a different set. So it's just, I just feel like you don't own all the, it's not about you, it's about who can you help. It's not ego based. If you have a question, if I can help you, please ask me. Like, if I don't know it, I'm going to find out. I'm going to ask someone more experienced, or we'll figure it out together. But you don't have, I'm trying to think of the words, but you don't own the knowledge. It's not about you and how much you know, and you being gatekeeper, that's the word, gatekeeper of your own knowledge. Like, you've got to share it with everyone however you can. Social media, mentoring, like CPD sessions, just chats with people. Podcasts,
whatever. Leave your ego at the door.
It's not a competition. There's plenty of kids to help. You just got to be good at what you do, right? And they'll come to you.
Absolutely. I think that notion of gatekeeping is so important to highlight, and getting beyond that. So to keep the gate open, in a few words, just a few words, what is...
Did you notice that you just said? Just a few words.
Just a few words. One or two. No, two or three. Whatever. What would you say... I'll say, because we're just chatting right now, what would you say to a clinician, therapist, someone who is feeling stuck in a rigid system?
Come and have a chat.
Come and have a chat?
Come and have a chat. If someone's feeling stuck...
Pitter Patter along the way.
Yeah. I just think that... yes, it's good to have boundaries, professional boundaries, etc., but it's also good to push those boundaries. So if it's something that you're feeling restricted by, maybe ask yourself why. Why are you feeling limited? Is it because it doesn't align with what you think the potential of the client is? Is it because it doesn't align with how you would like to do therapy or how you'd like to be as a therapist? And then just ask the question. Find someone to ask the questions about, I think.
Beautiful.
Don't be limited. Yeah.
Don't be limited. I love that.
You've said it pretty well. Communicate and go seek. Knowledge is power.
There's so much stuff on social media. You can find whatever you want to then discuss and look further. Obviously not
be discerning.
within reason. That's obviously there's a lot of dodgy
Make sure
stuff.
the thread's a good one. Use a great AI. Don't just trust any chatbot. Thank you so much. You've really helped us take a big leap out and have a bigger look at the scope of practice. And I think what's beautiful about this is that you've really highlighted again for me the significance of at every single angle we come at these things, it's relational, it's not transactional. And when we truly tap into that relationship, that's when the possibilities get unlocked. So thank you both for joining me.
Thank you.
Thank you for the opportunity.
Thank you.